Welcome back. The Al-Imdaad Foundation, together with the Department of Health, will conduct regular cataract camps to perform surgeries for patients. Now, the foundation will cover the cost for the consumables and drugs for the surgeries. Joining us is Abed Karrim, Head of Intergovernmental Relations at the foundation. Karrim, thank you so much for your time. I think if we just look at the statistics, speaking about more than 200,000 people in South Africa desperately needing cataract surgeries, what is causing that backlog and how has the foundation come in to address this?
Thank you very much and good afternoon to yourself and your viewers. Like you're rightfully correct that the statistics are absolutely high in all the provinces. And as the Al-Imdaad Foundation, and one of our projects in the health sector is known as Vision for Life, a year where we assist patients nationally and more specifically in our Durban office, where we have patients coming in to have their eyes tested, etc., and then be referred to the different hospitals. Coming to the national program of this month being the Eye Month, and of course the Eye, what they call day will be on the 9th, I believe. The Al-Imdaad Foundation has been in cataract operations nationally for the last 8 or 9 years. But in this month of Eye Month, we have a target of 1,000 operations to be done nationally. Now, cataracts being a very, very important procedure and operation to be done. It is a very effective and it is very treatable. But the biggest problem in our hospitals is the backlog. And there are many reasons to it. There are lack of surgeons at some point. There's a lack of equipment in some of the hospitals that we have been witnessing. There is lack of consumables, etc. You do not have the staffing and so forth. So what the Al-Imdaad Foundation has done over the years, and more specifically moving higher volume for this month of year being the Eye Care Month, is to partner nationally. So we had started in the Eastern Cape and we had supported 100 of the patients who were identified by the hospital eye care facility and brought in those patients. For example, Amakoko, Nonkulu, who are looking after child-headed houses, those who are employed and need to be, going back to work because their eyesight is not too good, so they were brought in front of the queue. And it is these blips, it is this high volume of cataract operations that we have rolled out nationally will assist and add value and bring relief to many of our senior citizens, those who are earning a livelihood in their homes, and also at the same time, most importantly, adding that happiness and value to our communities who have been waiting over a year, in some provinces even more.
Yeah.
So the Al-Imdaad Foundation is continuing with this support nationally.
And you speak about the high volume surgeries. Just how many surgeries are we talking about? How many people do you reach and how many lives have you changed?
Over the years, the Al-Imdaad Foundation has finished over, I would say, with the help of the Almighty, that we finished over 3,500 operations in the country. And every month we have these camps. In some provinces, they call them. In some provinces, they call them blitz. Some are called high volume. We do over 100 per weekend or 50 per weekend. Everything depends upon that they have the staffing, they have the physician, you have the consumables, you have the equipment, etc. And we are assisting and rolling with that. Our target for this month, hopefully, will be 1,000 operations nationally in Gauteng. We are busy with Swane Hospital, Pulesong Hospital, KZN, McCords, you got CJ Crooks, you got St. Andrews, in Mpumalanga, Ermelo, and another hospital that I don't come to my mind at this point, Western Cape, we have done Eastern Referral. We were last week in the Eastern Cape and we did the Frontier Hospital with the MEC of Health, and great support, great enthusiasm, lots of requests coming. Please put us into the queue. Please help us out. And I think this is very important, where the partnership of the Al-Imdaad Foundation and many other donors who are supporting us also is making an impact, and a great impact, and bringing eyesight. You and I know without eyesight, it is a different world altogether. And our whole idea, hopefully with the help of the Almighty, and of course, a community-based driven, a community effort, and all together, you say in Zulu, Noma Kanjani, Tina, we will assist and work with our people and our communities who are most vulnerable and those who are in need of these types of surgery, which doesn't even take 15 minutes, sometimes could be 20 minutes, if no complication. And we've seen what an impact. When you find Unkoko says, "Siyabonga kakhulu, thank you so much. I now can see my grandchildren." We had a situation like this where they said, "Thank you, Umtanwam. I can see my grandchildren today." You know what a feeling that is? For us all who have added a value in this cataract. And this is where the Al-Imdaad Foundation Vision for Life and making a difference and adding value on a national level. Throughout the year, we continue with this program.
And certainly making a difference. Just very quickly there, who qualifies for these surgeries and how do people find access to them? You've mentioned a number of hospitals. Where do people find such life-changing surgeries?
Each hospital has an eye care department. And the known number of cataracts that comes in, they go onto a list. And the unknown is still not even, we got to get cataracts finders to find them. So the list is via the hospital. They have lists that are people for 1 year, 2 years, 3 years. It is upon the hospital to decide and check which are the oldest patients waiting for cataracts, which are the most important ones, like I highlighted. There are some who are going to be earning their livelihood. They need these operations very quick. Then you need to look at Ukoko, Nomkulu. They are looking after grandchildren. They need this eyesight in the rural areas especially. So the hospital has its own criteria. We follow the criteria and the protocol of the hospital. We come in and support where the gap is. And I think this is important. The way the gap is, the Al-Imdaad Foundation will come in and all the criteria and protocols is run by the hospital itself. So we don't interfere in the due processes of understanding who comes first in the line, who comes second. But of course, we do advise that please put those who are priority, those who are going to be making a difference when they go back into the rural community and their homes or wherever their settings are, and have a change of life and can see the brightness end of the day. That's very important.
Yeah, definitely. Thank you so much for your time. That's Abed Karrim, the head of Intergovernmental Relations at the Al-Imdaad Foundation.